If you walked out of a doctor's appointment with a referral for circumcision, you might feel like surgery is your only path forward. However, international clinical guidelines are clear. Surgery should be the last option offered, not the first. There is a significant difference between receiving a brief medical recommendation to cut and getting a complete consultation about every available treatment option. Standard 15-minute appointments often prioritize clinical efficiency over long-term foreskin-preserving alternatives. Questioning an immediate surgical referral is a demand for the comprehensive standard of care that should have been provided during that initial appointment. While the diagnosis happens in a clinic, the reality of living with phimosis is handled in private. This silence often leads to severe, documented anxiety. The data shows a heavy psychological toll. Clinical research indicates that 79% of adult men with persistent phimosis experience impaired sexual onset. The impact extends to personal connections, with 46% of men avoiding romantic relationships entirely because of their condition. The physical tightness of the foreskin and the mental anxiety regarding intimacy are closely linked. Clinical studies show that resolving the physical condition consistently improves these psychological outcomes. Leaving phimosis untreated because you fear surgery simply trades physical discomfort for a quiet, persistent psychological burden. To understand your actual odds of avoiding surgery, we can look at what happens when large groups are required to try non-surgical methods first. In a major UK clinical series, over 600 patients were referred by their doctors specifically for phimosis surgery. After a proper trial of alternatives, only 95 of them ultimately required an operation. That is fewer than 1 in 6 men. For those who do genuinely need an operation, circumcision is not the only route. A primary alternative is a procedure called preputeoplasty. Preputeoplasty is a minor surgery performed under local anesthetic. It widens the preputeal opening without removing any tissue, allowing you to preserve your foreskin and recover faster. This option is rarely offered because patient awareness is low and many surgeons default to circumcision, the procedure they are most accustomed to performing. Accepting a standard circumcision without asking about preputeoplasty can mean unnecessarily sacrificing healthy tissue due to a lack of informed patient advocacy. For the vast majority of men, the first-line medical defense against phimosis is conservative therapy, which relies on gradual tissue adaptation. This therapy begins with manual stretching combined with a topical cream. You apply mild tension to the opening for 10 to 15 minutes, twice every day. To increase effectiveness, a doctor can prescribe a topical steroid like betamethasone to chemically soften the tight ring of tissue during the stretching process. When you combine daily stretching with these creams, peer-reviewed studies report a success rate between 85 and 96%. Reaching those success rates requires absolute daily compliance to the stretching routine. A 6-month clinical study found that every single treatment failure occurred in men who were inconsistent with their daily practice. Conservative therapy shifts the resolution of phimosis from the operating room to your daily routine. Your ability to avoid surgery is dictated by the discipline of your consistency. Before starting, you must understand the timeline. This is a 90-day commitment, not an overnight fix. During weeks 1 and 2, you will likely see no visible progress. This initial phase is where the vast majority of men mistakenly quit. While the opening doesn't look wider yet, the cellular structure of the tissue is adapting under the surface. It must prepare internally before it can physically yield. In weeks 3 through 6, you will experience the first slight measurable changes, with the tissue offering marginally less resistance. Weeks 5 through 10 serve as the primary progress window, where foreskin retractability measurably and visibly improves. Finally, use weeks 11 and 12 as an assessment checkpoint to honestly evaluate if the conservative method worked or if surgery is truly required. Enduring those first 2 weeks of invisible progress is the necessary trade-off required to achieve permanent physiological results. Ultimately, your decision is governed by the logic of timeline asymmetry. A 12-week trial of conservative treatment risks nothing except your time and a few minutes of daily effort. If the trial fails on day 90, both circumcision and preputeoplasty remain fully available options. Choosing immediate circumcision is a rush toward an irreversible decision, destroying the chance to ever attempt reversible, tissue-saving methods. Accurately identify your specific severity grade before starting any protocol to ensure the treatment matches your condition. Take the 2-minute Vajrayana self-assessment quiz linked in the description to receive a customized recovery plan. A brief evaluation today can save you from a permanent surgery you may not need.